thyroid function, and fertility. I'm going to tell you about an important new research study on hypothyroidism and fertility that may be a real game changer for couples struggling with infertility. It's a well-known fact that lower pregnancy rates are observed in women having an underactive thyroid gland. Because of the many complex factors that are involved in conception, the exact cause of lower pregnancy rates observed in hypothyroid women has never been demonstrated. This landmark study demonstrates that thyroid hormones have a direct effect on egg quality, which is the most important factor affecting a couple's ability to conceive. The study to be discussed is donor TSH levels are associated with clinical pregnancy rates among oocyte donation cycles. The authors of the study are from the Harvard School of Medicine and the Massachusetts General Hospital in Boston. This study was published in the Journal of Assisted Reproduction and Genetics in February 2016 by Springer Publications. This study is so important because it is the first research study to demonstrate the negative effect that hypothyroidism has on egg quality. This study was designed to evaluate if there was an association between the TSH levels of egg donors and the pregnancy rates of women who received embryos derived from the donor's eggs. This study compared the pregnancy rates produced by eggs from donors who were considered to be hypothyroid with TSH levels greater than 2.5 units, with the pregnancy rates from egg donors who had normal thyroid function as indicated by TSH levels under 2.5 units. A TSH cutoff of 2.5 units is used to define hypothyroidism in this study. According to current medical practice guidelines, a TSH level above 2.5 units defines hypothyroidism in pregnancy. In this study, 200 egg donors participated in a total of 232 consecutive fresh IVF donor-recipient treatment cycles. There were 161 donors with TSH levels below 2.5 units and 39 donors with TSH levels above the TSH cutoff point. The main outcomes measured in this study were the clinical pregnancy and the live birth rates. Egg donation is the ideal way of studying the effect of thyroid hormones on egg quality, embryo development, and pregnancy rates. This is because the majority of factors that could possibly affect conception, such as whether the egg and sperm meet and whether fertilization actually occurs, are eliminated by the transfer of fertilized eggs, called embryos, into another individual who is not hypothyroid. The effect of thyroid hormones on the quality of eggs can be evaluated since the eggs are already fertilized and are transferred at a comparable state of development. In the study, embryos derived from donated eggs are comparable, except for the fact that they either come from hypothyroid donors or from women whose thyroid function was judged to be normal. All other factors, such as the age of the egg donors and recipients, the medications received, and the number of embryos transferred, were the same for both groups. In this way, the pregnancy rates of eggs from hypothyroid women can be directly compared with the pregnancy rates obtained with eggs from women with normal thyroid function. Eggs from donors with normal thyroid function produce clinical pregnancies in 67% of cases, whereas eggs from donors who are hypothyroid produce pregnancies in 43% of cases. The results of the study clearly demonstrate that pregnancy rates were lower when eggs came from hypothyroid egg donors. In conclusion, it is shown that TSH levels of greater than 2.5 units as an indicator of the thyroid function of egg donors had an observable effect on the pregnancy rates. The results of this well-designed study has confirmed the validity of the long-standing clinical observation that diminished thyroid function has a negative effect upon conception. Therefore, all women trying to conceive should be sure to have a comprehensive evaluation of their thyroid function. The preconception TSH cutoff level for normal thyroid function in all women should be less than 2.5 units. Any woman trying to conceive should be treated with thyroid medication when the TSH level is near or above 2.5 units. Treatment with either synthetic or natural thyroid hormones during pregnancy is safe for both mother and fetus and should not be discontinued after conception. I hope that the information presented will be of value to you or to someone that you love. If you need to reach me, I can be found at the email address listed below.